Catherine Kuller from Armenia.
Thank you. Sorry.
Dear Professor, dear colleagues, examination of the hypothesis that brain blood flow autoregulation is dependent on intracranial pressure. Currently, there are two well-known autoregulatory mechanisms of blood flow in the brain: metabolic and neurogenic. Our observations and practice have indicated a possible third autoregulatory mechanism of blood circulation in the brain. We have named this mechanism the swing form, which is dependent on intracranial pressure. According to this hypothesis, during the elevation of intracranial pressure, the blood supply increases in the cortex and decreases in subcortical structures. During the depression ICP, the opposite changes occur. In order to understand the essence of the hypothesis, functional microanatomy of brain vessels should be reviewed. The circle of Willis is a structure which supplies the brain with blood. The vessels supplying the cortex originate from the anterior, middle, and posterior cerebral arteries. Before entering into the cortex, these arteries, beginning from the major branches and extending up to the gray matter, are located inside the CSF channels. They are attached to the walls of channels through collagen fibers. Before entering the cortex, they make a spiral loop. Penetrating arteries also beginning from the cycle of Willis, which supplies the subcortical structures, including the encephalon and basal ganglia. These arteries don't have spiral loops. Let's go back to the hypothesis. If the ICP increases, the arachnoidal membrane tensils and distends. The collagen fibers distract it, which causes straightening the loops. And secondly, the resistance of blood flow decreases in the cortical arteries, and the cortical blood supply increases. As a result of Still phenomena, the blood flow decreases through the penetrating arteries. If the ICP decreases, the arachnoidal membrane shrinks, the collagen fibers become loose, arteries hang down, and the loops become more curved, causing the blood supply of the cortex to decrease. The blood flows from the circle of Willis to the penetrating arteries. This hypothesis can be confirmed by EEG data. During hyperventilation, the ICP drops, but the amplitude of EEG waves elevates, which evidences about the depression of cortex. During hypoventilation, the ICP elevates while the amplitude of EEG waves decreases, which is due to activation of the cortex. If the hypothesis will be proven, some aspects of medicine will need to be revised. In particular, the variation of blood pressure in the circle of Willis plays an important role in pathogenesis or aneurysm formation. As you see, the quick variation of intracranial pressure may be the cause of slight changes in local blood pressure. Pathogenesis of traumatic brain injuries, including diffuse axonal injury, is controversial. This hypothesis may solve some questions. It's well known that epileptic activity increases during hyperventilation. According to present hypothesis, subcortical structures are stimulated during hyperventilation. Therefore, it's most likely that the epileptogenic focus is located in the subcortical structures. During neurosurgical procedures treating epilepsy or psychosurgery, The integrity of the arachnoidal membrane is damaged. ICP drops, leading to cortex depression. The symptoms of disease are regress. In time, the arachnoidal membrane recovers and signs of irritation to the cortex are returned. This may be the cause of a temporary effect on recurrences during such operations. It's vital to understand which mechanism for brain blood flow auto-regulation, to understand the pathogenesis of stroke, and choose the appropriate treatment. Our hypothesis suggests that during hypertensive hydrocephalus, subcortical structures are in a condition chronic hypoxia. In the case of moderate intracranial hypertension, the cortex is permanently active. This leads to early maturing of a child, leading to impression of a prodigy. Conversely, when a low pressure BP shunt is placed, the cortex does not develop normally due to chronic malnutrition. Blood circulation plays an important role in pathogenesis of Parkinson's disease and Huntington's chorea. Our hypothesis explains the regulation of blood supply of the striatal system. As a result of intracranial hypertension and chronic hypoxia of subcortical structures, the reticular nuclei are affected, and their activating influence to the cortex decreases, which manifests as neurosis. The hypothalamus is also being affected, which leads to the development of the encephalic syndrome. The pathogenesis of this is still unknown. During endotracheal anesthesia, arterial blood circulation can be sustained even with moderate hypoventilation. However, hypoventilation produces elevated ICP and the hypothalamus is hypoxic throughout anesthesia. The same is true for intubation in the neuro-ICU. The present list can be continued with multiple examples. We think that this hypothesis is a universal key which will help to unlock a number of doors into the brain secrets. If the hypothesis will be proven, solutions to controversial questions will need to be revised in neurosurgery, neurology, psychiatry, and psychology, as well as to social questions currently accepted worldwide. The hypothesis requires further study, revisions, and clinical assessment, which I ask you to do jointly. This is capital of Armenia, Yerevan, in summertime, in our famous mountain Ararat. Thank you.
Thank you very much.